joint. So typically the knee does extension and flexion. This is the primary motion that the knee goes through. A little bit of rotation internally and externally. Like valgus and then varus kind of motion. Most of these motions are really tight. It's limited. Covered with synovium. You have patella, which is the kneecap, and this patella is connected to the shin and to the thigh by tendons. Underneath the patella, there are bursas that actually allows these tendons to actually roll and slide with a lot of thick, strong muscles like the quadricep muscle, the hamstring muscle, the adductor muscle, and abductor. And these muscles are meant to allow motion such as extension, as well as flexion, and then slight internal rotation, slight external rotation. Muscles are supposed to be very strong, so that way it actually protects the joint capsule, meniscus, and there's ligaments that connects to these bones called cruciate ligament, and then medial collateral ligament, and lateral collateral ligament as well. So these bones together. Underneath the kneecap, there's a joint capsule. It's like a round ball, and that joint capsule, the synovium capsule, contains synovial fluid. Those fluid allows nourishment. It feeds the disc, feeds the joints of the knee. There's a structure called meniscus. In meniscus, there's a medial and the lateral meniscus cushioning effect. So when a person's jumping and inside, and without the meniscus, it leads to arthritis and degeneration. So inside to the anterior component of the tibia, and those that ligament comes from like this angle. And that ligament is called anterior cruciate ligament, and that's very, very important ligament for stability of the knee. That goes from here to here, called medial collateral ligament, and the outside ligament is called lateral collateral ligament, and there's another ligament behind called posterior cruciate ligament. Those ligaments do a very good job of supporting the knee, but it can't support by itself. It needs help of meniscus, joint capsule, along with all the muscles that we're going to talk about. These muscles called quadriceps, the rectus femoris, vastus medialis, vastus lateralis, allows the shins to actually extend out. This kind of extension, okay? Now, so having a strong hamstring muscle and strong thigh muscle controls those main motion. And it goes inside of the knee. That creates more of an internal rotation. So he rotates this way, okay? And then creates external rotation. So if these muscles are well developed, and Ethan's got a pretty big leg, these muscles actually protect a lot of the joint capsules and the ligaments. So some of the injuries that people tend to have knee injuries are like sports such as soccer and football. And soccer typically is very common because there's a lot of running, a lot of cutting motion. The shoes that they wear is cleats. The cleat actually digs into the turf and actually stabilizes the foot. Then all of a sudden, as you're turning and going to a different direction, it puts a lot of forces into the knee. Now football can cause a knee injury because people tend to tackle, decides to come in and tackle at this angle. That can create the knee to kind of cause valgus force and put stresses on the meniscus onto the ligament. Combative martial arts sports, you see quite often in MMA, and create this kind of force, that can cause also a lot of damage. Also, and it relaxes it, these tendons are supposed to roll over these bursa nice and smooth. Healthy joint fluid allows nourishment to the ligament, so there is no deterioration. How do we get healthy fluid into your joint? Drink a lot of water. Eat foods that are anti-inflammatory. Turmeric, those are anti-inflammatory herbs and supplements that you can help. Glucosamine, chondroitin, collagen, omega-3, essential fatty acids. All these things are very, very important component of keeping your joint nice and healthy. So, muscle, bursa, joint capsule, then ligament. And if you actually keep those things very healthy, then you can actually sustain proper, healthier knee for a long period of time. Psoas muscle, which connects from here, which is around this junction, is tight, then right hip goes up, then his thigh starts to intern rotate. So when he actually is in this position, people who have tight psoas, elevates the leg, which repositions the knee. Muscle that aligns from here to the side of the thigh gets extremely good. Hip bursitis, hip pain, but also it leads to stiffness and tightness in the knee to roll over to the side. It deviates the patella to the side, and that also puts a lot of stress in the inside of the knees. Sometimes when people have knee problem, it's not because they actually had the knee injury. It could be related to imbalances of the muscle that we just kind of explained. L2 all the way to S2. There's a lot of nerve that starts from this area, and they supply the hamstring, they supply the quadricep, they supply the IT band. So all these muscles are innervated by the nerves from here. A person has injuries to the back. Let's say they have a scoliosis, or they have disc herniation, or disc degeneration, and that irritation to this area causes interruption to the nerve from the back, which also interferes with the muscle function. So when these muscles are not working well, it also repositions the knee, which creates uneven load to the knee joint and causes some damages as well. It's too flat, it's rolling in. It brings this kind of angle, which puts a lot of stress on the meniscus. Now, ACL tear, anterior cruciate ligament is very, very common, and injury can cause a lot of debilitation. So typically with ACL tear, you have where the person actually reaches forward, creates a hyperextension, and creates a rotation, and creates a valgus force. So the knee starts to kind of bend this way, and it's a result of a forced, quick movement. And typically the ACL can be a partial tear, or it can be a complete rupture. With partial tear, there's a way of rehabbing, but with a complete rupture, you may actually have to do a grafting surgery where they take part of the hamstring or patella and weave it right through. Once again, there's a lot of good surgeries out there that could actually help correct. However, to make sure our body is strong enough not to get the tear is the key solutions as well. Arthritis can be managed properly through conservative care, but if it is quite severe, then knee replacement need to be warranted as well. Baker's cyst is when on the back of the knee, along with the swelling and pain, you'll feel a bump, or you can even see a bump. Trauma to the knee, and the synovial fluid starts to leak, and it creates a bulge. To have a lot of pressure on the backside, and when I palpate this area, there's a big bulge. And typically with the big bulge, we notice a lot of knee injuries from the front as well. So having a proper history is important. Doing a proper physical examination is also very, very important. But there are some imaging that we can do. For instance, X-ray will show joint degeneration, calcification. Also on the X-ray, we can actually determine the alignment of the body. X-ray of the knee, X-ray of the back, it can be related. It can be related to the problem to the lower back. Ultrasound actually shows some soft tissue. It's actually a gold standard for checking out meniscus, ligaments, and also joints. There's different types of care. One is prevention. Prevention is when you don't have a knee problem and you do things that's necessary to prevent any further problem from happening. So getting regular exercise, conservative approach. So treatments such as laser, acupuncture, and fire cupping that Dr. was going to show you rehabilitate some of the minor injuries that you may have. Big arthritic changes that's been there for a long time, and the bone and joints are all degenerated, and you can't function, then you may need to do some surgical intervention to try and help it out. We have a lot of different techniques. We have techniques that allow soft tissue breakage, acupuncture, chiropractic care, taping. And the Graston tool allows soft tissue maneuvers, soft tissue work to help break scar tissue down. Tension to the IT band and quadricep. And stretch it out by itself may be very limiting. So we may use a technique called Graston. Through this, we can feel areas in the tissue that feels really gritty. It feels like a sandpaper. And a lot of times, people don't even know that they have scar tissue until we start to work on it. This type of technique allows the tissue, the connective tissue, to be nice and soft, so the muscle starts to stretch out, so the patella or the kneecap doesn't laterally deviate, which puts less stress on the knee itself. We use something called kinesio tape. So the kinesio tape, the whole purpose of kinesio tape is not to brace the knee, reinforce the knee joint. Okay, kind going around the kneecap to help support the knee joint, allow motion. Bend your knees, please, and then extend it out. So this taping allows the support, but same time it allows reinforcement of the muscle and not binding the joint. Now, along with this, we use laser to help us do chiropractic care and alignment to reposition the spine. So I see a lot of people who have knee issue. Sometimes we don't even treat the knee itself. We can be treating other sources of the problem that actually relates to the knee as well. As you get older, you start to kind of notice that your healing becomes slower. The laser does actually helps to speed it up. And a lot of people who have inflammation, swelling, and it's all on fire, the laser actually does that to reduce the inflammation and help pick up the speed of the healing much quicker.
Yeah. Spin 10, so this the superior of the kneecap. So we put 3 fingers in here. The point will be on here. 10, so it's very good to regulate the spin function and improve the blood circulation. The meridian 33, which is located on the back of the IT band tendon.
It's connected to the tight IT band, and when you have tight IT band, it also causes patellofemoral syndrome where the patella, the kneecap, starts to deviate sideways.
Yeah, you can also cause it, or you can grab in 40 just on the midpoint of the crease on the back of your knee. This point, because this meridian runs from the head down to the back and go down to your posterior, your big toe and your second toe, just in the depression in here. So the liver acupuncture points is very good to improve the liver function, to improve the circulation, to help to nourish the tendon, the muscle, and the soft tissue. The whole body in the same time help the knee to release the tension.
What you can do is raise up your left or right leg and just kind of hold it in position. And that allows all these muscles around this area to help kind of firing and stimulating to protect the knee joint. Now, reach out to 12 o'clock and bring it out to 6 o'clock. Reach behind to 8 o'clock. Up, reach to 10 o'clock. Back up, reach to 12 o'clock. A good way to not only keep balance, but using dynamic motion to allow a little bit more challenge to the joint capsule and pull. So as he pulls and keeping the knee straight, you're stretching the back side of the calf, which also stretches the Achilles tendon, and these calf muscle also connects to the back side of the knee. Very important stretch. Get up, stretching the calf, and then switch over, opposite side. Okay, so this helps to stretch the hamstring, the calf, and also the IT band. Okay, flexibility is very important, everyone. Rolling the IT band. Okay, good idea to help loosen up the tendon as well. Okay, so doing some self-rolling to loosen up the muscle. Very good. Heels planted. Bring the pelvis up. Keep it neutral. And as he's doing this, he's contracting isometrically on the hamstring. Also is putting pressure on the knee joint itself. And keeping it for a few seconds and relax. And bring it up again. Same thing. Tighten, tighten, and tighten. Okay? Extend it out. So you're putting a little bit more challenge to the knee joint. Down. And then bring left leg up. So same thing. And he bridges up. And as he do that, he's actually extending it out. So what he's doing is he's contracting the hamstring, but also he's contracting the IT band to strengthen the abductor, the knee, and he brings it up. And as you do that, he's actually pressing against the ball. Now you're working the adductor muscle. So there are several muscles that we're working: the quadricep, the hamstring, abductor, and adductor. All these muscles that get strong supports the knee as well. And isometrically, and pretend there's an invisible seat. Okay, he can do that. Again, strengthening the butt, the hamstring, the knee. Very good strength exercise to help fortify the muscle. And then please, as he does that, he's actually extending it out, creating, again, lateral strength to the IT band to support the knee joint.
So we can tension of the IT band, so we can.
He does traditional Chinese fire cupping.
Yeah. So if on the IT band we just to fast the cups first.
How's this muscle, Dr. Wu?
The muscles, it looks maybe a little bit short, the tension of the muscle, and also improve the circulation for releasing. On spin 10, and we can also put superior of the patella, so just to improve.
Structure, different causes, and a lot of people have different problems. I mean, some people have actual real bad injury. Some people may have problem for a long, long period of time. We treat knee problem all the time in our clinic, and we have very, very good results. If you have any questions, we are offering a free consultation. It's an email. Send us an email, and we love doing this. We love sharing information to people. So reach us out, and if you want a consultation, we'll set up a time over the phone, and then discuss what your problem or challenge may be. And we can give you some good suggestions that can help you at home. Also, maybe suggestions to improve you in the way you feel.